Cater. So we're going to be turning our attention to private GPs. Apparently more and more of us are turning to private GPs simply to get an appointment on time. According to a survey of 2,000 adults, 32% have gone private in the past 3 years. That's nearly a third. And 53%, more than half, said they would consider using a private GP. Alex, if you can afford it, do you have a moral duty, considering the current waiting list in the NHS, to go private?
So I'm in category 2. I happen not to have needed to, but if I did, I would certainly consider it. And I remember when... I remember reading Somerset Maugham's accounts of working in hospitals and seeing wealthy patients coming to hospitals for the impoverished and saying, you shouldn't be here, you should be going and paying for the treatment you're getting. When we founded the NHS, they didn't build new hospitals. They took hospitals that were private into the public sector. And it seems to me that there's something you can learn from that process and about the duty that the more wealthy have to put their hands in their pocket from time to time if they can, to pay for their treatment and relieve the burden on the system. And because people are so committed, and understandably, to the NHS, I think they sometimes confuse that and try to pour scorn on the use of private healthcare systems and say that it is bad. If you Google now private GP in the UK, you'll find a dozen people willing to see you within 24 hours, depending on where you live, but probably about a dozen different providers willing to do that. And when you do it, you're lifting the burden from the public sector and voluntarily choosing to pay more to an alternative resource. I think that's good. And indeed, I would probably make it partially tax deductible. Well,
there is that. But first, Joe, is it fair, if you've been paying taxes throughout your life, for the government to encourage you to go private because, arguably, the NHS has been mismanaged?
Well, there's several things to unpick in this. One is, we hear all the time that GPs are overworked, under-resourced, and the burden on them is absolutely massive. So those GPs who've decided to work in private practice, you know, maybe there's a question, I know we're not going to talk about the BMA strike and all that stuff, but maybe there's a way that you say to people, right, if you are sent to medical school, which is basically funded by us, you have to commit to working for a certain number of years within the NHS before you go private. So that's one thing. So, you know, whilst you can say if we were paying for it, are taking away 3 people off a waiting list, the person who's seeing us isn't seeing the people who are still on the waiting list.
So you'd say to the doctors as they graduate, you can't go to Australia for at least... Well, not Australia. You can't go work privately until you've done 7 years in the NHS.
But
you can't go off to Australia.
It's a reasonable comparison.
Yeah, you can't go off to Australia.
You know, you can't have it every way. And I think the NHS is in such a fundamental mess through years of austerity, years of mismanagement, years of targets hither and yon, and it's sort of lost track of what it's for. And I think until we have a government or a cross-party group of people who are prepared to sit down and say, right, what is it for? Where's the bit about primary care? Where's the bit about preventative care? Where's the bit about tackling obesity? You know, we've got a record number of people with type 2 diabetes. Most of that is reversible, and most of that is because of bad diets. Now, some of that will be to do with poverty, for sure, but a lot of it is to do with lifestyle choices. So, you know, you can't have it every which way.
No, you can't.
And the thing that I think is very interesting, which has happened a lot in the last few years, is that the NHS is now using private hospital facilities, which is hurrying up, you know, fairly straightforward things like cataract operations, for instance. Now, that seems to me to be quite a sensible partnership.
And this is something the Labour Party is now comfortable with too. If you've seen their recent messaging, they seem to think that's a good way of cutting down the waiting list.
They are for now.
For now,
but
yes.
I mean,
can believe it.
If you've got a hospital, and certainly near where I live, you know, there's a private hospital virtually within the grounds of the NHS hospital. If you go privately, you'll have your operation in the NHS hospital, but you'll then go and recover.
Your convalescence.
And crucially, you'll get your treatment quicker, and that is why people are going privately. But I'm interested in I think there are a lot of people who feel like they've done the right thing all their lives, they've worked hard, they've paid their taxes, and now, for a service that they have contributed or feel like they've contributed to so much, to almost be encouraged not to now use it.
I understand that.
Is that fair?
I understand that frustration, but there will, of course, be people who will feel exactly the same, that they've made their contributions, but can't, for whatever reason, afford to go private, who need to see their GP through the public system more quickly. And others taking themselves out of that queue help that. So actually it cuts both ways, I think, in the way that you've put it. And just one thing, it's not a zero-sum game about doctors choosing to work. And bear in mind, GPs are all private sector. They're not employed by the sector. People forget that, and they talk about the NHS as if they're all public sector.
No,
GPs are not.
They're run like little businesses.
They've always been in the private sector. You can be a doctor and come to this country to work in our private healthcare system. We all think it's just a brain drain going another way. But actually, we attract talent to work in our private sector system. And some of that, not a huge amount, but some of that will be doing private GP services. And so the more we encourage that and facilitate that, we can reverse a little of the brain drain. And that's a good thing too.
Well, should we make private healthcare tax deductible in some way? Because you are alleviating pressure, so why should you have to pay more and more?
Because you're then benefiting twice, and you're then in danger of facilitating a real two-tier system. I mean, look what's happening.
At the moment, we have a two-tier system.
Well, we don't. We've got a pile of waiting lists going, up as a mountain that is not going to be reduced. The problem what has happened with dentistry, where it's almost impossible in some parts of the country to find an NHS dentist, and waiting lists for private dentists are very, very long as well. So there is, you've got to manage it, because if you fundamentally believe that we have a national health service system available to everybody in the ethos of how it was formed and founded. But then you have to make some really tough decisions, and that's where it all goes wrong.
But that ethos and that belief can be absolutely compatible with the kind of relief that you're talking about. I never suggested it should be completely tax deductible. These things, if you want to get treatment more quickly and you want to pay for it, it should be, it shouldn't be completely tax deductible. And, but my point is the other way. Even a very small incentive, the state returning 5 or 10% of that money to you, would see an explosion in private sector provision, which is not to the detriment of the NHS.
But it's also fair, though, isn't it? Because you've already paid your taxes towards a system that you're then not using.
Yes, I know, but I mean, lots of people pay taxes for things that they don't use.
True.
People pay taxes.
But then some people think private school fees should be tax deductible, but others obviously don't agree.
But, there's a perfectly good analogy. If you're going to do it for private healthcare, why wouldn't you do it for private school fees?
We do.
Tax deductible.
Yeah, most of it with a charitable status.
But that's
for the schools, not for the individual.
Oh, I see what you mean.
Yeah. But, I mean, the only way that would, I think, would be palatable to a lot of people, including me, would be if you then hypothecated that somehow or other.
It's not that hard. Lots of countries do. Through healthcare. Most of our neighbours do. Most of the Anglosphere does. And of course the inevitable comparison we always get is, oh, you want us to be like America?
No.
We have to be rich, otherwise you die.
You can be like France.
Yes, exactly.
Which works perfectly well and perfectly fairly. But it also puts a huge onus on people. So if you're going into hospital in France to an operation, let's say you're having an operation on your lungs, they won't touch you unless they know that you're fit, you're healthy, you're going to follow through with the aftercare, whether it's, physiotherapy or exercise or whatever. And they're much more rigorous about doing that.
That's interesting because it takes us back to your point about diabetes and so forth. Because when the NHS was founded, it had a dual mission. It was to heal the nation, keep the nation fit and healthy, keep the nation well. And that latter, naturally, the focus goes on trying to cure people of conditions and treat their injuries.
How many of those conditions are preventable?
We forget that other mission that the NHS is supposed to have.
Well, I'm not sure how you make people treat themselves better.
Well,
it's the whole conversation about whether public health, campaigning.
I'm not necessarily endorsing it at all. I'm just simply saying there's a lot of people.
But public health is exactly that. It's public health, and it comes down to everything, including the state of our rivers and our seas. If you're pumping raw sewage into waterways, if you're allowing chemicals and things to go into the water, that's going to have an effect.
But a lot of the time, it comes down to sort of trying to make packets of crisps smaller, or banning sugar, or
I can tell you packets of crisps are smaller.
They are.
They certainly are.
Changing the recipes in chocolate bars.
Tiny.
The popular ice creams over the decades.
Taking the sugar out of Iron Brew. I mean, I don't think these things make much of a difference.
But that's a perfectly good point, Emily. Things that are stating the bleeding obvious, why do we still have an argument, and why is it only now that companies say, oh, with reduced sugar or reduced salt or this, that...
Kept the price the same.
Yeah.
Well, yes, let's get a couple of views before we move on to our next topic. Marjorie agrees with Alex. She says if a person uses private healthcare, they should be able to deduct the premium from their tax. I think there is a clear logic to that one. Brett says, as a bus driver, I had to sign an agreement that they would pay for the driver training, but if I left before 2 years' service, I would pay back the cost of training.
Loads of examples like that in the
Good
private
idea
sector.
to apply a similar system to doctors.
Yeah, I would.
Absolutely.
There you go. Let's get one or two more. Chris said, I'd be happy to go private, but I would also have to pay for the healthcare of people who have more poorer choices in life than me. That's true. You do pay twice in that case if you count your taxes as paying for it. Initially, Cyril says, if people start switching to private healthcare, it will eventually become as bad as the present NHS. Just saying, well, I don't know about that because there'd be different incentives. So it may just grow and grow on its own. I don't know, but people might see this as a backdoor into privatising the NHS.
But if you get people seen more quickly, if you get diagnosis more quickly and you get treatment more quickly, then actually you're taking the pressure off the health service.
That used to work, that threat. Yeah, 48 hours to save the NHS. There's only so many times people can say that. Tory's been in government 13 years. There's the NHS as central to our national life as ever.
It's like saying there's going to be an ice age next year or the planet's going to go up in flames. Anyway, we must move on. Landlords. Apparently hundreds of thousands of them are about to, or in the next 5 years, going to abandon the market altogether. Are we too tough on landlords?